First of all, I wanted to thank everyone who has registered to attend to our webinar and also our speakers who will be joining us here today. We have an hour planned of activities where we're first going to start with some greetings and introduction. Then we're going to have a panel discussion. Thanks to all the donors who've submitted questions. We have organized them and I have assigned to the speakers that we have with us. Then we're gonna try to leave some 10 minutes at the end for open Q&A, which you're gonna use the chat feature to send your questions. And then we'll try to take on as many of those questions as possible. And then at the very end, we'll just make some closing remarks and wrap it up. I first wanted to also acknowledge that we are recording the session, so we have kept your cameras and mics closed for that, so you don't have to worry about your privacy, but also we can ensure that the session is running smoothly. I also want to acknowledge and thank the presence of Talia Betty from the Associated Press and from Kat Lay from The Guardian, who are joining us here today as attendees to the webinar. The Rapid Response Fund has been active for over a month now. In fact, we're approaching 40 days. And so this webinar is going to be an opportunity for us to provide a transparent update on the impact that we've had so far and also share some of our next steps. I'm Barbara Calixto. I'm the Chief Marketing and Product Officer at The Life You Can Save, and I'll be moderating the session today. And I have joining me as speakers, Jessica Mesa, co-CEO of The Life You Can Save, Matt Lerner, Managing Director of Research from the Founders Pledge, Matias Nestore, Research and Evaluation Manager from The Life You Can Save. And then we have 3 of the organizations that we have already granted to as part of the Rapid Response Fund grantees, and I am very thankful for having them here. Ciarán, I apologize if I'm not pronouncing your name correctly. Ciarán Donnelly, SVP of Crisis Response, Recovery and Development from International Rescue Committee, IRC. We also have Niek, founder and CEO of Goal 3. And we have Dr. Werner Schultink, Executive Director of Iodine Global Network. Thank you for being with us. And I'm looking forward to a very interesting discussion with you. So for those of you who've joined us, a lot of the attendees here today have been donors that have already contributed to the fund. I also know we have some people who are joining because they have some questions and they want to know more about what's going on with this. So let me start with just sharing some of our results on these first 40 days, right? So overall, we've raised over 3 million already. And we have already granted 1.3 million of those 3 million we've raised, of which 600,000 are currently being processed. So haven't reached the organizations yet, but they're in process of. I'm not going to read through all the grants we have already made in the interest of time, but both on the Founders Pledge website and the Life You Can Save website, we are keeping the grants up to date within maybe a few days delay, just to give that time of processing and making sure the money has reached our grantees. But you can see here the kind of organization that we are supporting, the kind of program that we are supporting through the grants. And we are lucky to count on 3 of these organizations here today to tell us about what's going on, which is the perfect segue to welcoming once again our grantees. And I think that's the place where we want to start. We've seen a lot about the numbers of funds that are being cut and some of how this has repercuted, but I think it's very good to hear from those of you who are on the ground, which is why I'm going to start by asking Niek from Goal 3 to share with us how has the aid cuts impacted Goal 3 operations in Malawi, and what steps have you taken to sustain the work in face of this challenge?
Yeah, thank you for this question. So maybe our situation is a bit specific in the sense that we're a combination of social enterprise and a foundation supporting the work in Malawi. And I think the aid cuts come at a very crucial point in time of our development. So we see very strong impact results from the field with extremely high cost effectiveness. And we're really in the phase whereby we're really trying to move from like smaller scale projects to really large scale adoption together with the Ministry of Health, with the idea that we can really help hospitals to achieve more with the scarce resources which are there. And actually, the aid cut has resulted in an overnight stop into, 3-4 large projects, which totally add up to 150 Impala monitors for about 10 different hospitals, in addition to development costs, other costs that are not covered by the grant, which were really about how do we integrate it better into the system. And I think that also reflects the impact. So ultimately, Goal 3 is not the one who is hit hardest by this, right? It's the people on the ground delivering the care. It's the patients in need of care who are even hit worse by this, because ultimately it's the same funding that was also funding the Ministry of Health of Malawi. And basically there's a scramble for resources and time about how are we going to recover this gap. For us, what we are luckily enough fortunate about is to really look for where can we find alternative funding to really make sure that we can continue and expand the operations, because ultimately what we do is really about, addressing the exact same challenge that we see now is about how do you achieve most with the scarce people and resources which are there. So we already had a quite diversified our portfolio of funding. And that's what we continue to invest with. And we also really look how can we partner with the hospitals, with the government to really, expand on the work that we're doing and that we can support them in, these hardest times. So let me stop here.
Okay, thank you, Niek. Can you comment on how long can these services, and more specifically the ones we've enabled through the grant, how long can these be sustained without additional support?
Yeah, so ultimately our whole model was designed to achieve sustainable change. So the whole model is about that you use grant funding to start, and then that there's a local service model, subscription model for hospitals to continue after this. Of course, it has become more uncertain in current funding circumstances that hospitals will be able to pay after 1 year. But basically, this grant allows us to do the implementations to help the hospitals. And basically, because we actually see cost savings which are higher than the cost of the intervention itself, our expectation is that hospitals will be able to continue to pay after the first year so that we can sustain the intervention within these hospitals. Indefinite is too long, but for a minimum of 5 to 10 years, that's really what our aim is and of our model is. And of course, in parallel, we will be looking also for other options, funding options to expand the work that we're doing.
So every implementation is done with the goal of then achieving that sustainable funding afterwards with the savings that you generate.
Yeah, exactly. So it's about how do you streamline care in a very harsh environment, allowing health systems to transition from reactive to proactive care that saves lives, time, costs, and that basically optimizes the system and brings it into a better system, a situation, breaking the vicious cycle of reactive care. And that's kind of where this grant really helps us a lot in advancing that further.
Okay, thank you, Niek. I'm going to switch over to Dr. Werner now. How has IGN adapted to ensure continuity in critical iodine deficiency monitoring and support in Madagascar? And have you been able to secure alternative funding or had to cut back on activities?
Yes, good afternoon from Ottawa to everybody. Barbara, thank you for the question. First of all, the Iodine Global Network, IGN, has worked in Madagascar since about 2013. And the main partners were UNICEF and the government of Madagascar, of course, as well as a number of salt producers. At the time when we started, there was a severe iodine deficiency, especially among pregnant women, at the level that it would definitely have an impact on the brain development of the newborns. Over the past 10 years, we worked with our partners on the ground and we provided technical guidance and advice. We did situation assessments. We assisted the government in designing a new policy on salt iodization to combat iodine deficiency. And we provided in modest supplies the fortificant as well as some other minor financial assistance. Now, in 2023, the US government appointed an organization called Afford to continue to build on the work of iGen. And I should also mention that because of the collaboration between iGen and UNICEF, in 2022, it was shown that the overlarge majority of households in Madagascar had achieved access to well-iodized salt. So it was a major impact. In 2023, Afford, the USAID-supported organization, took this over and worked on 2 or 3 things. The main things doing a situation assessment of a national survey, and then to provide assistance to salt producers to improve the quality of their product. They worked on these things. They finalized a kind of a pilot situation, and then abruptly the support from USAID was cut off. So now we're in a situation where the survey results have not yet been completely analyzed. We're in a situation where there is a draft quality assurance and quality control guideline available, but not yet operationalized. And the government does not exactly know how to handle a revolving fund to buy the fortificant. So given our experience and given the fact that we were part of a technical committee working also to oversee the work of Afford, we are now looking to pick up where they left off again and to ensure that the situation will not slide back to the levels of where it was, let's say, in 2014.
Okay, thank you for that. That's very interesting. So can you share what would have happened if the grant wasn't made available, and what would be the short and long-term implications of this program being discontinued at the stage it is now?
Yeah, so if we are not able to continue our work there and, using the money which we've already received in part from you, although it's very hard to explain what will happen because, looking into the future may be a difficult thing. But in 2014, after the collapse of the program, which was initially there, women suffered from severe iodine deficiency, and about 43% of school-aged children had goiters, which is a swelling of the thyroid gland in the neck, and which indicates severe impact of iodine deficiency. So it's not unimaginable that we would slowly but surely go back in that direction, which is, of course, something we want to avoid. I would also like to mention that besides the work in Madagascar, we're also experiencing the impact of the cutbacks of US aid in countries such as Lebanon, Iraq, Egypt, Sri Lanka, and Bangladesh.
Of course. Thank you. Thank you for that, Dr. Werner. Now, I would like to ask Ciarán Donnelly from IRC, if you could comment on how have the aid cuts affected your ability to deliver life-saving malnutrition treatment, and what are the immediate consequences for the communities you serve?
Great, thanks, Barbara, and thanks for having us here today. Just by way of context, the International Rescue Committee, our budget for this year would have been about 40% funded by the US government prior to the cuts. We served 38 million people last year, 14 million of those with US government funding. So that's really what's at stake in terms of the critical services we provide globally. In terms of malnutrition, it's one of the most impactful and critical of the services we provide. It impacts on the most vulnerable, children under the age of 5, who are literally on the verge often of death as a result of severe and acute malnutrition. And the services we provide are literally life-saving through the administration of therapeutic feeding products and intensive care. I can take you back to the last days of January. On January 24th, when the suspension of the US Foreign Assistance Program was announced, that very evening we received our first suspension notices of our malnutrition program, and every other US fund. All of our portfolio was suspended. And on January 28th, I had to convene a meeting to talk about the 41 stabilization centers that treat malnourished kids that we operate with US government funding. In these centers, which are essentially intensive care units, kids receive round-the-clock care with therapeutic feeding products to keep them alive, help them recover, and stave off the long-term impacts of malnutrition. We had to decide, do we close the doors of those centers in compliance with the US government instructions and send those kids home to a literal death sentence in their communities with their families? Or do we somehow find a way to keep them open? The choice was obvious. Scrambled and found a small amount of internal funding to tell our teams around the world, keep the centers open, don't send the kids home. And then we immediately started reaching out to partners to identify funding to keep those services open, a literal lifeline for those children. And we're deeply grateful to Founders Pledge for being the first recipient, I believe, of your funding, part of that rapid response initiative that enabled us to keep those centers open.
Thank you. Thank you so much for sharing that. While this grant helped treat 800 children, it covered only a fraction of the funding gap that you're facing. So what is the current status, and how long can your malnutrition centers continue operating without additional support?
We've been building a coalition of supporters, both existing dedicated supporters and those new to the IRC, to come together and help salvage our malnutrition programs, but also other critical programs. What we have today is basically enough funding to keep those services running for about another 3 months. Situation changes daily as we get different instructions in respect of different projects from the US government, but that's kind of where we're at right now.
Okay.
But what we're doing in parallel, so we're doing two things. One is we are actively fundraising through a campaign to launch a Survive Fund, which will enable us to essentially replace US government funding in the long term and keep those services running on a more sustainable basis. But secondly, we see an opportunity here to drive real reform in how malnutrition programming is administered in humanitarian settings. Our research has helped us develop a treatment protocol that is 21% more cost effective than the standard of care today. We see a breakdown in the supply chain of therapeutic feeding products that we think can be resolved. We think we can bring together a coalition of implementers, of policymakers and donors to not just replace what's been lost through the US funding cuts, but also to build a much more effective and responsive system for malnutrition treatment in emergency. So we have a 3-month lifeline, but we're very much building for the future at the same time.
Okay, excellent. Thank you, Ciarán, for walking us through this. Thank you, all three of you, for sharing how this has been impacting your operations and how you've been responding. I'm sure we'll have some more questions about the impacts and how this has been dealt with in these initial days, and certainly looking into the future. I will now shift to some of the questions that we received from donors that were interested in knowing about the process of setting up and operating a fund, especially in the face of so many cuts and so many programs that are at risk right now. So the first question I have here is going to be to you, Jessica. If you could speak about why did the Life You Can Save, in partnership with the Founders Pledge, have decided to create the Rapid Response Fund instead of fundraising for individual charities?
Yeah, so well, first of all, thank you to everyone who's attending, and thank you so much to my fellow panelists for sharing this incredible work you guys are doing on the ground. From just their stories alone, you can hear like why we would create a fund or why we would want to take action in helping save lives. It really, the idea was really born from like, what can we do in the face of this massive change, and doing this work for long enough, you really get a sense of like what's at stake and what can really happen. And so we really wanted to take action. And with a challenge of this magnitude, doing it alone isn't optimal, because there's so much coordination needed, particularly with other funders who are funding similar things that you might be funding, right? So the last thing the ecosystem needs right now is everybody funneling money to the same organization. What we need to be doing is coordinating and ensuring that that as many programs as possible and as many organizations as possible are being sustained. And so doing it in partnership with Founders Pledge made a huge amount of sense. And so we're really thankful to them that they're also doing it with us.
Great, thank you, Jess. Now I'd like to ask Matt Lerner if you could share with us how do we balance the urgency of immediate funding, the immediate funding gaps, with the need for careful evaluation and long-term sustainability when deciding where to allocate these limited resources.
Thanks, Barbara. Yeah, so it's definitely tricky. Things are moving really fast. I want to note two critical things up front. So one is that on the one hand, the long term for many of the most cost-effective interventions that exist is more uncertain than it's ever been before. The other thing I want to note is that the situation was already dire before USAID froze funding. So it's urgent, but there was an urgent situation for unfunded beneficiaries of IRC's malnutrition program or IGN's iodine programs before. So like there was already room for funding. Now that's just more dire. So in terms of balancing these needs, we're really focused on marginal cost effectiveness, inclusive of all factors. And at a simple level, that just means that our main consideration is just what a dollar can accomplish that wouldn't have been accomplished if we didn't spend it. So that's in terms of lives saved, lives improved. If a program is sustainable in the long term, that's great. And that's optimal, but we don't want to gamble on long-term sustainability at the cost of people's lives. Like another way of saying that is we don't want to not fund stuff that will save people's lives just because it won't exist next year. If we see a program that can save 10 lives next week, but we're unsure whether the program will exist next year, that doesn't necessarily mean it's a bad idea. The key question in terms of balancing these factors is just whether we can find something that's equally life-saving in the long term, even after we take uncertainty into account. As far as the need for careful evaluation goes, of course, that's why we exist. Founders Pledge. We're fortunate, or at least well prepared, to already have a really thorough evidence base to rely on for many interventions and programs. So part of the reason why we were able to deploy funding so quickly to Goal 3 and to IGN and to IRC is that, as I mentioned, there was already a need for funding before the USAID freeze, and we had ready evaluations determining that these programs were cost effective beforehand. So there's some judgment calls here, but the grants we've made and the grants that we're going to make are generally taking one of two paths. Either they're funding an intervention, like the ones you see on this call that has already been very well studied and about which we already have really high confidence, or they're bigger swings that are justified principally by the urgency of the situation. So, there will be things that benefit from careful attention bounded by the urgency of the situation. We are hoping to balance those things by making sure that when we fund something that is more uncertain, it's something that has such big rewards and is so urgent that it's worth taking that uncertainty on board. So the main thing I would leave off with, sorry for kind of long-winded answer, is that it's really a place of enormous leverage right now, and aid could go a lot of different directions. So we have to both fill the gaps we can fill, which unfortunately is not that much, at least not unless we raise 70 billion for the rapid response fund, and also just trying really hard to possibly affect the trajectory of future aid. And I'll leave it there.
Okay. Thank you, Matt. Thanks so much for that. Jessica, the next question I have for you is from a donor who asked, what were the challenges in setting something up so quickly, and what would you do differently next time or wish you had done in advance?
So I think we anticipated more challenges than we actually experienced, which I think is a real credit to the two organizations that are involved, and I would say all the team that are behind those of us on this call. So obviously executing really quickly because we know the need is so urgent. So how do you get something live? And there's just a bunch of operational stuff that needs to happen. How do you get attention on the fund? Like, how do you get people interested? How do you get conversations going with donors? How do you get on people's calendars? These types of things. And then how do we achieve scale, right? Like, as Matt was just saying, like, it's a massive gap. So how do we get big enough to where we can have a lot of impact. And so I would say, like, for our first challenge, with Founders Pledge as our partner, they have this incredible infrastructure set up. So they're really taking the lead on the operational side of things. And it's been incredibly smooth and impactful, very fast. We've been really successful at getting money in and getting money out to those who need it. On our side at the Life You Can Save, we really have a strong marketing engine built up. We've been able to, tap into relationships we have that have given us access to help amplify our effort, reach new audiences, get press placements, these types of things. For the scale, that's the one thing I would call out. I think I would echo what Matt was saying again, that, I think we're so amazingly grateful to everyone who has given to the fund, and like to be surpassing 3 million in such a short amount of time is amazing. But the reality is the gap is still so massive. And to echo what Matt was saying, like, there were gaps before. So for anybody who's been kind of sitting and waiting to see, like, oh, is aid going to come back? And, maybe my money isn't as critical. Like, I would challenge that line of thinking, and I would encourage you to recognize that there were really big funding gaps before, meaning these organizations could absorb a lot of capital to scale what they were doing before. And so now is the time to really get your capital off the sidelines. And if you think about your grant as an investment, like, now is the time that you will have massive impact return. So I would just say, we so deeply appreciate the scale we've achieved, but we're really hoping that we can do multiples more.
Yes, thank you. Thanks, Jess. Matias, I'm going to ask you to take the next question. With many high-impact charities in need of urgent support, how are you evaluating where the need is greatest and which programs can deliver the most impact per dollar right now?
Okay, thanks, Barbara. Yeah, that is a good question. So obviously we've had to make trade-offs and really difficult decisions, but as Matt was saying, we had been making these decisions for a long time and for many years in our respective teams, and now we're making this together. So we base our decision making on 3 core criteria against which we evaluate different programs and funding opportunities. And these are the ability to have high impact at scale, the ability to deliver a cost-effective intervention, and deliver an intervention that is backed by rigorous evidence. For the purpose of the fund, we're also looking at where urgency exists and where we could lose investments that had already been made and resources that had been put in place to deliver certain life-saving interventions. So to tie this to some of the grants that we've made, for example, we've recently given a grant to an organization called Thanku that works on malnutrition in Ethiopia. In their case, we know that they can deliver at scale in a context like Ethiopia, where there's a high need to address malnutrition. Thanku is able to deliver their intervention for as little as almost as close as 10 cents per beneficiary. And we know that food fortification, which is what they do, is an effective intervention that can help really make progress in terms of health outcomes. Similarly, for example, what Dr. Schultink was mentioning earlier, there is a risk that certain programs and the progress that had been made for years could be lost, and we wanted to step in those contexts to make sure that those programs are sustained, at least for some time until new programs or new funding comes in.
All right, thank you. Matt Lerner, I think you can take this next one. Do you collaborate with international organizations and governments to maximize impact on a global scale?
Yeah, good question. In a word, the answer is yes. I think I should elaborate a little bit. So expertise from implementers is a critical part of our model of operation, because we want to, as part of our model, we want to be having access to expertise, and the experts in this case are international organizations and governments. So when we do an evaluation of a funding opportunity, we talk to government staffers, at home and abroad. We talk to large international organizations responsible for funding and implementing. I think that the critical point that I want to make is that we aren't engaging in a really time-intensive way with these entities because they're doing important work. So the point that I would make is, these organizations are supplying expertise that helps us evaluate ways to fund new programs, but we have a lane and we want to stay in it. Our lane is interpreting the evidence, finding the most effective things to give to, and steering money toward them. That's why we exist. We don't, for instance, view it as our role to share our opinion with governments of lower middle income countries on how they should spend money. That's not what we do. That's not our expertise. So, our expertise is finding the highest leverage places to intervene, to spend donor money in order to make incremental change. And like when I say incremental change, what I really mean is like saving individual people's lives in a cost-effective way, and also just effectuate structural change. So a lot of what we've been funding with the RRF is direct delivery work. And as Jess was mentioning, it's really only a drop in the bucket, but I hope we'll at some point soon have news to share about higher leverage grants to just help the global aid system adjust to the new reality.
Awesome. Thank you. Thanks, Matt. Jessica, can I get back to you and ask you to comment on other similar initiatives that are being done, and what level of coordination have we been able to achieve with other organizations that are also fundraising to support the organizations impacted by foreign aid cuts?
Yeah, so I think we've been in touch with most everyone, if not all, every fund that exists or everyone who's trying to do something. Like we were saying before, collaboration in this situation is so key, and coordinating like where funding's going is really important so that we can help, be most impactful in the situation. But beyond just understanding what each other are doing, we're not necessarily directly collaborating in the same manner as we are with Founders Pledge.
Right. Thank you. So now, Matias, we have another question here that is about other opportunities for funding. So the question is, have there been situations where you've identified a compelling funding need but had to hold back due to limited resources? How much more could we achieve if additional funds were available?
Yeah, thanks, Barbara. So yeah, the short answer is yes. Many, I think we've prioritized, short-term life-saving opportunities to start with, and as Matt was mentioning, direct implementation. And we've mostly focused on the areas where we think we can make the most difference per dollar, that are, malnutrition, child mortality, in terms of both malaria and medical equipment. But there are many more areas that we could be working in. An example could be, agriculture and food security. One of our partners, One Acre Fund, for example, has multiple programs in countries in Eastern and Southern Africa that we could be supporting, helping farmers, at critical moments during the year to make sure that that they get enough crops at the time of harvest. And we could address those they have gaps of around $300,000 to $500,000 for each of those countries. Similarly, there are areas like HIV prevention and treatment, reproductive health. One of our partners, which is Population Services International, for example, does a lot of work in the area. And they have, again, for each of those projects, there are gaps of $500,000 to $1 million that are really challenging for us to fill at this point. Aside from that, there's also the longer term thinking that we're doing in terms of, okay, if this is the situation moving forward, if we have to imagine a world where we don't have the similar amount of aid, what are the things that could be high leverage to fund now? And then, as Matt was saying, to kind of shape the direction of foreign aid in the future, or the direction of these programs. So there could be things like strengthening local systems, the capacity of local governments to deliver sort of technical assistance work, like IGN, for example, is already doing, and others as well, or improving the efficiency of current programs or data systems. There's almost an infinite amount of things that we could be funding that we could run through our evaluation criteria and then really support to make a big impact.
Awesome. Thank you, Matias. Matt, within the same lines, but looking at larger grants, like really grants beyond $1 or even $2 million and higher, because again, we're talking about funding gaps that are so massive. What kinds of high impact opportunities are currently on hold simply because the fund hasn't yet raised that we haven't raised enough funds to support them? And what would additional funding unlock in the coming weeks or months? Like really talking about the big ticket ones.
Sure. I'll try and give a more concise answer. So first thing I would say is, yeah, so the organizations that you see on the call here also have additional room for funding. There are programs that sort of can't use additional money on the margin. So what I mean is if you give them $100, they won't be able to do anything with it because they need a much larger amount of money to even get started. So there are a number of large programs that USAID is planning on fully funding that simply can't be restarted with comparatively small amount of money. So to give one example, Against Malaria Foundation. So Against Malaria Foundation saves lives very cost effectively. They distribute anti-malarial insecticide-treated bed nets. They had a project which USAID was planning a fund at the level of $27 million. Because of the infrastructure required, it simply cannot get off the ground without many millions of dollars, somewhere in the low millions to even get started. In Democratic Republic of Congo, Give Directly has a gap of $2 million that they need to just get their program running, as far as I understand it. I think, in a conversation about the efficiency of government spending on aid, Give Directly is a really stark example because it's about as efficient as it gets in terms of where the money goes, right? So something like 90% of, not 90 cents out of every dollar just ends up in somebody's pocket, like the poorest people in the world. And this program basically just needs startup scale. Another example, one we've researched really heavily here at Founders Pledge is Teaching at the Right Level Africa. So that implements basically the single most evidence-backed education intervention. They need $1.5 million to continue operations in Uganda. There are many more examples like this. And I think one of the sort of sadder things about the situation is that it's actually unclear how many discrete programs there are like this that can't even get started without additional funding. They're sort of living in a situation of uncertainty about where the money is going to come from. So yes, there are many such examples.
Okay. Well, thank you very much. I think we've had a good idea of what's going on, and then hopefully we've been able to answer some of the most pressing questions we received from the registered attendees. I think this is a good moment to just assert the fact that, as you can see, there's a lot of work being done. The need is huge, and if there's one thing that is clear to us is there is an opportunity to make an impact right now. This is not the time to wait on the sidelines. This is the time to act. So for anyone who was on the fence or trying to decide what was the right move to do in face of this situation, I want to reiterate what has been said here. The need exists. The ability to put these funds to good use is there. Just like the 3 organizations that we have been represented here today, there are many more that are willing and able to act and waiting on the resources. And at the same time, every day that passes, the situation gets more critical. So I want to take a moment here to share with you, if you are interested in donating, you can scan the QR codes and get to the donation pages. If you have questions or you want to discuss larger volumes of donation, you are welcome to reach out to one of our teams and we'll be happy to assist you. And so now I'm going to take an opportunity to open for Q&A. And what I'm going to ask the team to do, I'm going to ask you guys to do is submit questions via the Zoom Q&A feature that you have there. And so we're going to try to take as many questions as we can before we wrap this up. Okay. I see someone's typing in a question here. Okay. So the first question I have here, and I'm gonna Okay, so I'm sorry, I'm going to shift here because I think this connects to something that we have not discussed yet. Does the Life You Can Save or Founders Pledge have an option to create a fundraiser for the Rapid Response Fund? I understand that this question is related to operationally, can we enable donors to create a fundraiser that would then be directing funds to the rationals, to the Rapid Response Fund? Matt, are you able to answer this question?
Whether we have an option to create a fundraiser, I'm actually sorry, I'm not totally sure what that means.
Yeah, I think it means a fundraising campaign. So let's say I want to have my family and friends donate to the Rapid Response Fund.
I guess we don't have infrastructure in place for that, but we'd be open to, I guess, depending on the size of a fundraiser, we'd be open to working with individuals to help them with provide collateral or a donation link or something like that.
Okay.
Yeah, so I would imagine like just like simply, like if you want to do something simple, like I want to create a Facebook, like my birthday's coming, donate to that. I think you can just include the link to the every.org page or other links like that Barbara shared before. If you want to do like an event or something like that, that's not something that we're like planning at the moment. But like Matt said, if it's a significant enough scale, we are happy to engage in a conversation to evaluate opportunities.
Okay, great. Thank you. I have another question here related to how do we balance going broad, so multiple small grants, versus going deep, which is putting substantial money towards a few organizations. Matt, do you want to take that one?
Sure. I think the first thing to say about that is that it is in fact hard, and to just be sort of candid about one consideration. Many donors to a fund like this want to see their money being spent in many different places, which is a real consideration for us. So it is possible, and we've discussed this a lot internally, that in fact the most cost-effective thing to do would be to spend the money all in one place. But there is an argument for diversifying your charitable funding targets. So to a significant extent, this is why one of the criteria for the funds is saving programs where possible. So our primary consideration, right, is cost effectiveness. The constraint on that is like this strong interest in saving programs because that opens up funding for more funders. I hope that sort of makes sense. The idea is we are funding multiple different programs, and the idea behind doing that, as opposed to plunging it all in the most cost-effective thing, is this hope that we can serve both just a sort of timeline extension, just survival, and also signaling function to other, hopefully larger donors.
Okay, thank you. I have two questions here, at least that I can see. Maybe there's even a third one about the more or less the same topic. So I'm gonna bring this up. Jess, can you speak to what is our best guess for the total opportunity set for this fund? In other words, what has been the impact for the organizations that you have already evaluated and recommend specifically?
You mean like the opportunities, like the funding gap or the opportunity
Yes,
of like how much
the
money?
funding gap
Okay.
for the organizations that both Founders
Yeah.
Pledge and the
Okay.
Life You Can Save have already evaluated.
Yeah, within our basic basket of recommendations, we've identified over $100 million in funding gap between what Founders Pledge recommends and what Life You Can Save recommends. So it's a massive amount of money.
Sure, thank you. Okay. And also, I just got back from one of our teams attending the webinar, going back to the first question regarding the fundraiser. Yes, if you go to every.org, you are able to create a fundraising campaign, share with your family and friends, and the money will be allocated to the Rapid Response Fund. I have another question here. Well, this is going to be a question either to Matias or Matt. In international aid, there's always a tension between upstream and downstream support. Much of the support described on this call sounds downstream. How do you think about that tension?
Yeah, I'm happy to take it. So we definitely consider that, but as we were saying earlier, we started off with trying to sustain programs that were addressing downstream interventions, as the example that Ciarán was giving, where you would have kids in clinics that would have to be sent home because they would not be able to otherwise access treatment. So we prioritize life-saving interventions of that sort, and then I guess if we keep raising funds, we will also consider more upstream interventions, such as preventative work, educational work as well in certain areas. And we would definitely be willing to support those and fund those. But that's how we've been thinking of what is urgent and where a delay would cause a significant loss in life or in health, whereas a delay in education may definitely cause trouble, or a delay in prevention will have impact on the life, but it gives more time for other implementers, maybe local implementers, to react as well. So that's how we thought about it internally.
Okay, thank you. Thank you very much. I have another question here for you, Jess. So can you say a little bit more about the work that is currently being done between Founders Pledge and the Life You Can Save to put the Rapid Response Fund in front of additional donors, especially those high capacity donors that could make more substantial gifts?
Yeah, so obviously I think both the fundraising teams internal in both organizations have been having one-on-one conversations with their recurring donors. We've seen donors who haven't given in some time actually come back and be inspired to give in this situation. So it's opened the door again to restart some conversations, which is amazing. And we've definitely seen new donors come and give, being motivated by the urgent needs. We are ongoing doing all of the marketing efforts that any organization typically does. We have our PR team helping us try to get placements in high-level publications where, David, the CEO of Founders Pledge, and I have done a couple interviews together. We've done a podcast interview. So we're doing a lot of, we're putting a lot of effort into publicizing this. Obviously, this webinar is an example, and then we are doing traditional marketing online via social media to try to reach a broader mass market audience.
Thank you. I have another question here that I think that Matt, you can take this one because it relates a little bit to one of the topics you discussed before. Are there any organizations that were not being recommended by the Life You Can Save or Founders Pledge prior to the creation of the Rapid Response Fund that are now being reconsidered or have already been funded by the Rapid Response Fund?
Yes, good question. Yeah, there will be. There are a few grants that are in progress now. I just a slight like sort of logistical note about that. It's like we are not necessarily going to continue recommending these organizations in perpetuity, but we are seeing that they have room for funding, and we will make grants to them in the expectation and the evaluation that those grants will be highly cost effective. In some cases, this is because just we're taking a second look at something, that we missed the first time around. And in other cases, it's because genuinely there was no room for funding before, and there is now. And I think that is for people on this call, and in particular for Americans on this call. I do think that it suggests a kind of call to action that you can sort of take away from you. Like there's basically 3 points that I would want to leave people with as we're coming to the end. One, it's now you sort of see in the public conversation about this that foreign aid was not really at the top of people's minds, and I think people now aren't really sure what to think about it. So I would just sort of encourage people to their friends and families and workplaces to make 3 points. Like one would be that until recently, it was possible to save lives very cheaply and that the US government was funding it in a very big way, saving many millions of lives. Two is that that was like a really, really small part of the US budget. And three is that that's now stopped. Um, so you can share the Rapid Response Fund with people you know, life you can save, and Founders Pledge continue to do this work, irrespective of the situation. But simply sharing this information with people, irrespective of how they decide to help, can be pretty high leverage.
Okay, thank you. Thank you very much. I have another question here and I'd like this to be answered by each one of the three organizations that are here represented. And we can start with, I'm going to start with Dr. Werner, and then Niek, and then Ciarán. If you think about the landscape for you and your organization in 2030, what is the best case forecast and what is the worst case? And I'm going to add to this another question that I think will be really well paired with this, which is what has been the impact of the aid cuts, and how quickly could those be how quickly could you recover from them if the United States were to, in the future, in this administration or next, re-implement those foreign aids?
Okay, well, thank you very much for those easy questions. First of all, the best and worst case scenario. I think one thing to consider is that this cut in aid is probably going to have an impact on the wider thinking in many countries on the use of development aid and what to do with it. So already in many other countries, there are cuts which will have an impact on all this kind of work we're trying to do. And it will increase the need to become more cost efficient, to do better ways of data collection and analysis, and to find ways which enable governments of countries in Africa, Asia, Latin America to take on more responsibility by themselves, even in situations where you have a very limited amount of funding available. So the type of work we try to do with IGN is exactly along those lines. How can you optimize the use of costs? How can you really work with governments to take on their own national owned programs to ensure that there is a long-term improved situation with iodine deficiency? Mm-hmm. A best case scenario for me is that there is hopefully a reawakening on the thinking of the importance of development aid for many different reasons, including immigration and all these types of things, and maybe production of many different things in countries where they are now looking for aid. And hopefully the interest by also private donors such as yourselves will continue to be there and will continue to feed our types of works and so on. The worst case scenario is that we continue on the current paths by international development aid, and that the enormous increase in requests for organizations like yours will force you to dilute, recipients and so on, and the amount of money you can give. And then it will become, I think, quite bleak for a lot of organizations. But like I said, I hope that IGN's work with a focus on low-cost interventions, national ownership, and providing changed tools to do this type of work will help to address the situation. Thank you.
Thank you very much, Dr. Werner. Niek, would love to hear from you on the same.
Yeah, so I concur with the view on how things are changing. I think in a way that makes the timing good. So if you look at the short term, so basically what we do, the reason I started this in the first place, because I feel that we can achieve more with less, and that's the results we're showing. We're showing a cost per life year saved currently around $1.6 to $3.3 for pediatric and neonatal care. We see a reduction in workload for health workers. We see cost savings higher than the cost of the intervention. So if you look at what we provide, I think we are somehow it's a no-brainer for philanthropy, for hospitals, whatsoever. And I think the grant that has been given is very pivotal to us, specifically because we also have to get to the point where we can really show this and make this survive until that we can really bring it forward. And I think therefore the grant, especially for us as an organization, is very important with regards to timing, and that's why we're so grateful to Founder Pledge and the Lives You Can Save, because it allows us to bridge a very important gap. If you really look at the upsides, I think because we have a business model underlying it, and we can make a business case for investors even at hospital level, at different levels, and we have been diversifying that. I think we will survive and we can grow. We're very big on where we are. But then the philanthropy part of things is very important to really come at places where it's needed most, because ultimately market dynamics will only get you so far if you want to help vulnerable people. And I think that's really why we have a hybrid form. It's really about how can we get reach as many people as we can with the little money that is there. And that means that in Malawi, for example, where the grant is for, it is hit really hard. It will take years for them to recover. It has impacts way beyond the health system, because actually we see a depreciation of the kwacha of 50% because aid is pulling back, and a lot of their forex is coming from USAID and organizations. And so you cannot underestimate the impact that it has on the societies that it has. So I'm positive about what we do. We were designed for agility, for achieving more what we can. So the upside is very high. The downside, I think, is mostly on the vulnerable populations and our ability to help there where it's really needed the most. And that's really where I'm really concerned.
Yeah. Certainly. Ciarán, can you add to that from your perspective, what you see the landscape looking like within the next 5 years, and what's the best and worst case that you've forecasted so far?
Yeah, thanks. So obviously a question that begs a much longer discussion. Best case, I would say, is that within the sector, humanitarian development, that we don't waste the opportunity in crisis to drive real reform in how we work and then deliver in the field, but also how we work and structure at headquarters, and how we partner with donors to drive funding to our priorities. And that's accompanied by a reversal of the political consensus that is quite anti-aid these days, that the political conditions enable more funding and more investment in conflict resolution and providing solutions to humanitarian crises. The worst case is obviously the flip side of that, right? That we trundle along doing business as usual, thinking nothing needs to change and we'll somehow survive. And the prevailing political winds continue to squeeze us on funding and in prolonging conflicts that drive up need around the world. In terms of the question on the impact of aid cuts and how we could respond, I mean, from our perspective, we're going to be 35% smaller next year, where we've laid off already over 4,000 staff, and there's more to come. We're going to close out of 7 countries that we've spent years building up a presence in. But we will still have a very large portfolio in 35 of the most crisis-affected countries in the world that provides us with the foundation to build back from. I mentioned earlier the 14 million people served by US government funding last year that we won't be serving next year. I'm setting my teams a challenge of how we can reach 50 million people a year by 2033, which is our 100-year anniversary. And then while I have the floor, one thing I just want to call out and acknowledge, but I think it's also an important part of the future, is forging the right kinds of partnerships with organizations like yours, in addition to the good points that Matt and Matias have made about cost effectiveness and urgency. The willingness to provide flexible funding to organizations like ours in times of great fluidity reflects a trust in us, in our stewardship and our ability to deliver, that we don't take lightly. And I'm sure I speak for other panelists too in that, but is also, I think, essential for building a foundation for effective and responsive delivery over the future. So thank you for that.
Thank you. Thank you so much for everyone who submitted questions, who have joined us and have participated on this webinar. Thank you very much again to our speakers, especially. Thank you to our grantees who are here representing your organizations, and thank you for the incredible work that you're doing. I had a number of other very interesting questions that I would like to ask if we had the time. Unfortunately, we don't, because we are at the top of the hour. I'm going to leave this here one more time to those of you who are interested in donating, or you want to get in touch because you have questions that haven't been answered here. We're being as transparent as we can along this process. And the goal is to continue building upon that transparency. So questions are welcome, suggestions are welcome, feedback is welcome, and most certainly donations and support to this work are also very appreciated. Thank you, everyone. Good evening or good day to all of you, depending on where you're joining us from. And we'll keep you posted on what's coming next. Thank you very much.